AAC Myths Part 2. This presentation is part 2 of the AAC Myths series presented by NWACS and will address 2 more of the top 4 AAC myths that seem to be most prevalent. These common myths are often mentioned on AAC websites such as Assistive Wear, Tobii Dynavox, and ASHA's, the American Speech Language Hearing Association's practice portal. Myth number 3. A person can be too impaired to benefit from AAC. This myth is the perception that a person can somehow be too impaired, or what used to be called low functioning, to benefit from AAC. It is very difficult to measure the cognitive skills of individuals with complex bodies. It can be a catch-22, because language is needed to measure cognitive skills, and the individual first needs to learn language to take most cognitive tests. In the absence of a comprehensive language system, it is impossible to measure language or cognitive skills. Therefore, it is important for the SLP and other professionals to not fall into this trap. We must make all attempts to teach AAC to all individuals. As was mentioned in Part 1 of our AAC Myths series, a communicator does not have to demonstrate any pre-skills in order to introduce AAC. We must assume that once the best AAC system is selected, the individual will eventually learn to use that system. As Dr. Karen Erickson says, we do not pretend that the person does not have a disability. We assume that the person will learn despite their disability. The NJC Communication Bill of Rights also reminds us that every single person has the right to access communication. We are responsible for giving access to and teaching communication. Although an older citation, the facts of this research remain true. Language skills can be demonstrated by a person with complex communication needs. Myth number 4. A person must first demonstrate cause and effect before introducing AAC. Similar to myth number 3, a person that is thought to have cognitive skills too impaired to learn language also may not be able to demonstrate cause and effect in traditional ways. Keep in mind that many of these complex learners have complex bodies. This sometimes prevents them from being able to show others that they have an understanding of cause and effect. We all understand that there is a correlation between cognitive skills and language. However, it is possible for a learner to use language without showing traditional cause and effect skills. Consider instead that a communicator may learn or demonstrate cause and effect by using AAC. Kangas, Lloyd, and Zangari suggest that cognitive abilities, including cause and effect, are difficult to measure in certain populations. More to the point, this cognitive skill is not a prerequisite to learning communication. The key takeaway from the research debunking these 2 myths is that communication, and AAC, is a basic human right that cannot be withheld based on perceived cognitive abilities. Here are the full references for the research cited in this presentation, along with a few links to articles with additional supporting research.